answer here? I think this will be. Okay, what's your answer, guys? Okay, the answer is 3. The neurological condition of the child continues to show impairment at the moment. Their respiratory status is stable and the highest working does not lie in monitoring infection or intake and output. Okay, so again, your answer is LOC. Okay, LOC. Okay, let's try to take note. Okay, so here, guys. Okay, so this is the one. Okay, so that's why we have the LOC. Okay, okay, so that's why. Okay, in answering this one, guys, in answering this one, you have to base it on this. Okay, so breathing appears normal.
Study Nclex with me day 1.
Ba yung cellphone ko?
Andyan sa may sa may dun, sa may mga sa upuan. Mag-ano ka,
Like, how will I set this?
Ayan, dito na ano, 4-year-old.
Uy, wala doon. Ano naman ito?
Buksan mo ilaw, buksan mo
May
ilaw.
mga bata eh.
Wala ka bang flashlight sa ano? Maka-live ako ah. Mura ko dyan.
So that it will only be forward this. I'll work on my wait for a while, guys. My God, if technical is scary. Of course, the answer is okay. Very good for those who answer 3, 4, 5. Okay, that's the best answer. So this is a type of seizure known as your febrile, okay, or febrile seizure. Okay. So when you look at the temperature, it's 40. Okay, and become unresponsive. Okay, so according to the parent, the child become unresponsive, and then the rigidity and spasm. Okay, so rationale. It is vital. If you want to screenshot this one, guys, do it now. Okay, those are the answer. So that is how you answered highlighted. That is actually how you answered highlighted. That the previous one that you are the one that will answer, is it a phrase or a sentence? You will be having that difficulty. But the real Nclex is already in grayscale. So you have just to click. Okay? If they will say highlight 3, or sometimes they will not say highlight 3, they will say highlight important, something like that. But it's good also if they will say number. It's either they will say number or how many to highlight, or it's either you will be the one to decide on how or what to highlight. It's still the same as extended SATA. Okay? Extended SATA. So here we go. It is vital to acknowledge that the child is displaying symptoms of a common illness rather than more severe indication. The observed seizure symptoms that align with those typically associated with febrile seizure of the chronic type are unresponsiveness, okay, limb rigidity, and shaking. Okay, noting the duration of the seizure is important since seizure lasting over 15 minutes. Okay, usually necessitate transfer to the emergency room. So the 45 minutes, although it's already also an emergency case, that 45 minutes is already too long because most of the seizure will just have a duration of seconds, right? But 45 is already long. But when it is over 15, you need to call the 911. Okay, if it is over 15 minutes duration, yes. Okay, so it needs, okay, it usually necessitates transfer to the emergency room. Okay, so as for recommendations, again guys, this is again, it depends on the protocol, okay, or depends on the doctor's order or the protocol of the hospital. So that's it. And another one, if you want to screenshot, please screenshot 5, 4, 3, 2, 1. Okay, so next question. By the way, this is now the answer. Okay, so the highlighted is the answer. Okay, I remember my mom used to tell me when I was a kid, every time I get fever, even though it's one, yes. But usually guys, when you say febrile seizure, you can outgrow that one. That is what happened to my brother. So if ever there is fever, it's because if you have fever, your brain increases the oxygen demand if you have fever. So that is also happening to my brother, guys. Every time he had fever, guys, it is really vivid on my mind what will happen. My mother will directly run to Chongwa Hospital. We were crying back then. I was 5 years old. My sister is 3 years old. My brother is still kinupan. And then when he had seizure, guys, everyone, we are crying. My mother is sorry. My mother will be doing that one, guys. And then, you know what, guys? That time, that was way back 1980s. I don't know where they get this thing. That they will put something on the mouth to prevent the biting. That is the practice before. That is the practice before. So, I remember our helper, the metal spoon. Imagine the metal spoon. She will just put it. And my mother will take our helper. So now, thank you, Hilda. Those were the days, okay? But right now, you cannot put anything in the mouth during seizure. Huh? I don't know. I don't know if that is the practice in 1980, but I remember that one. Okay? So let's proceed. Remember that one time, guys. Remember in running to the hospital, guys, the slippers were not part. The two slippers that were my mother wore, they are not partnered. Not the partner slippers. Did you realize in the hospital that her slippers were different? The slippers were different. Okay. Now how about next? Okay. But of course that is really one of the how do you call this one? I'm not saying agony, but that's one of the challenges of parents if you have child with seizure. Even with less, it's easy to say. It's easy to say. This is what we do if there is seizure. Protect the head, sideline. It's easy to say that. But when there is a person having that one or having seizure class, you freeze. So let's go on, huh? Okay, let's go to the next one. Okay. Identify the four primary priorities for the triagers we want about from the parents and grab them in the right column. What will be the answer?
Study
Okay,
Nclex
just four.
with me.
Just four.
Thank you
Give
for
one other
subscribing.
talking about to prevent tongue. Okay, yes, Ma'am Phyllis. Okay, five perfect. They feared biting the tongue. That is really true. Okay? That's really
Let's
true.
have
So,
some
what will be the answer
coffee.
here?
Guys, coffee.
Okay, answer. Of course. Respiratory status. Okay. Let's have the general. This is not the final answer yet. Huh? What else? What else? Three. Okay. This is not the final answer. Status. Very good. What else? What else?
I got correct.
Okay. Five. Somebody's answer six and seven. Let's. Okay. Okay. Somebody answer five. It's already more than four. So let's do the answer, guys. Okay, final answer. Okay, here we go. Respiratory status, of course, you're correct. Okay, airway is the first one. Neurologic status. Okay, medical history and child location and position. Okay, so that's the answer, guys. Okay, so the nurse needs to identify if the child is in immediate physical or physiologic danger. In a triage setting, this is often completed by standard questions. So, the child's birth history, intake, and output and developmental status are not priority. The nurse will need to know if the child has any underlying medical condition or has received any medications recently. Okay, because there are some medications that can induce seizure. Okay, so take note of those things, guys. Okay, so again. Okay, so we have here, this is the final answer. I hope you get it, guys.
Mali pala.
Okay, I hope you get it. So out of 7, you have to choose 4.
Respiratory status. Respiratory status. Neurologic status. Medical history. And child physical location and position. Seven, spine, neurologic status. Oh, it's not. Respite, neurological, child, oo nga, no? Okay, yun. Medical history.
Although everything might be needed, also that you have to choose the 4 priority. Okay, so get perfect. Get perfect. Sir Marco, I thought it's GCS.
Nclex.
Okay.
I will
Now let's
beat
proceed. Okay, let's go to the next one. Okay, number 3. Additional information gathered from the parent reveals that the child has not taken any fever-reducing medication within the past 24 hours. The parent confirms that the child did not sustain any head injury or experience trauma during seizure. So, usually guys, one of the cause of seizure, although the exact cause is unknown, but one of the cause is trauma or head injury. So the parent described the child as being unenergetic, minimally responsive, and currently lying on their side on the floor. The child's breathing appears to be normal and their lips have a healthy pink color. The parent mentioned that the child has a febrile seizure when they were 2 years old, but has not had any seizure since then. Other than that, the child is in good health with no known allergy. The only medication that the child takes is multivitamin. The child's most recent weight was recorded as 36 pounds, okay, or that is 16.4. Okay, so drag the appropriate word from the choices, okay, to fill in the blank of the following sentence. I think there's a blank here, right? So I think it's only one. It's only one. Drag the most appropriate. Okay, word from the choice. Okay, what will be the answer here? I think this will be. Okay, what's your answer, guys? Okay, the answer is 3. The neurological condition of the child continues to show impairment at the moment. Their respiratory status is stable and the highest priority does apply in monitoring infection or intake and output. Okay. So, again, your answer is LOC. Okay, LOC. Let's try to okay, so here guys. Okay, so this is the one. Okay, so that's why we have the LOC. Okay, okay, so that's why. Okay, in answering this one, guys, in answering this one, you have to base it on this. Okay, so breathing appears normal. And the lips are healthy pink. Okay, so that means there is already good oxygenation. Okay, or there must be good oxygen saturation. Okay, and okay, that's the answer. Okay, so minimally responsive. So responsive. Okay, so that's it, guys. So that's why, guys, I remember this is one of my experience class in the airport because usually when I was still in the Philippines, I used to travel a lot to do lectures face to face. So my flight is 1 a.m. That is in Mactan Airport, Cebu. So for example, this is the area there, guys, for the check-in, and then there are chairs here. On the other side, there are also chairs here, class. So it's full with passenger here. Then I am on the fifth. Okay, seat. There was a foreigner here, class. Okay, in front of this one. He's the only one here on the seat. And then suddenly, guys, the foreigner just do this one. But then, guys, he fell on the floor. He hit his head on the floor.
Oh.
I remember that one. And you know what's our reaction? Everyone, because we are facing him, class. So I'm here, class. You know what's our reaction, guys? Because the foreigner, he is a European class, okay? Good thing is at the airport, I think somebody goes, guys, hey, emergency, emergency. So, okay, the rescuer just went there, class. There were doctors, I think, class from the airport, and then they are even bringing class, external defibrillator. So see, that's why class, I always tell you this class, it's easy to say. Protect the head, use your leg, or slide up into the floor, protect the head. It's easy to say, but actually, that is what our teacher or our clinical instructor told us. If there is a seizure, okay, protect the head, side like. That's the only thing that you can do. Okay? It will just stop. It will just stop. So you just have to be patient that, it will just stop. But the first in reality, the reactions of people here text. So see, it's easy to say, but in reality, it really happened. As it was really shocked also, guys. Okay, but of course, I am here on the fifth, and everyone is saying,
I hope I can pass Nclex part. Thank you for watching. Please subscribe. Hate exhaustion.
Have somebody like to accompany him or her. Imagine the monitor is only alone. Because I think most
Are you also a nurse now? Park
occasions,
literally before exam. In times 2 speed. I can't just speed in times 2. I just speed in 1.75. It's too fast for me.
Because sometimes you get stressed if you have company jurisdiction and trouble. Okay, now let's move on. C4, additional information gathered, so I think we have already this one. So I just put it like this class so that it will be easier, but it's still the same. Okay, now let's go directly to the 1245. The parent informs that the child did not open their eyes, but with limited movement and continues to exhibit significant lethargy. Okay. The child's respiratory condition remains stable. Okay, so there is lethargy. Okay, but stable RR. The parent conducted auxiliary temperature, which raised 39.5, 103.1. Healthcare providers did notify the diagnosed the child with febrile seizure. Okay. Sir, if the scenario is too long. Okay. Ma'am Eliza, in the real Nclex, okay. The scenario is too long, is within the page. It's within the page. So, what are you going to do in the real Nclex? There is, like, for example, there is a case study here. There are pointers here, like, for example, notes, nurses notes, diagnostic test, vital signs, okay, doctor's order. You just have to click that one, and then it will drop down. So you don't have to go to the next page in the real scenario, the real Nclex. So you just have to click the drop down, nurses notes, progress notes, or nurses notes, drop down, vital signs. Then the question is on the side. The question is on the side. So, what will happen, guys, in a case study, the case is still there on the right side. So it's not, unless if you submit the question, you cannot go back to the question once you submit the one. So you cannot go, so once you submit back, next question. But the case study is still there on the left side. There is a case study there. Okay, thank you for that question, ma'am. So that's it. Okay, sir, medical bracelet would help, sir. Yes, sir, Franco. That is medical bracelet if you have seizure. That's a must. I think that is a must here in the US, no? Okay, so how about next one, guys? Okay, let's proceed. Okay, this is now the question. Please indicate whether its potential, okay, potential intervention is appropriate or not appropriate. It's only the question that once you submit that you cannot go back, but the case study is still there. The case study is there, okay, on the left side and right side, if you're facing to your question, right side is the first one, something like that, okay. So, here we go. Febrile seizure, okay, what would be the potential intervention? Potential intervention. Okay, let's have the answer, guys. Okay, I'll reveal the answer immediately. Okay, so here we go. So, you might be asking, sir, why is there anti-epileptic prescription? Let's have this one by one, guys, okay? Rationale. The reasoning behind the provided intervention is as follows. It is normal for a child to feel lethargic after seizure. Okay? Because usually two guys, after seizure, the patient will feel fatigue, lethargy, drowsiness, dizziness. Okay? So that will be the expression after a seizure. And that is a post-ictal phase. Okay? During this time, it's not appropriate to administer oral medication or fluid to the child. Okay? So managing fever is important, and the preferred method for a child who is neurologically affected is through the rectal route if available. Okay? However, a cool bath should not be used as a means of managing the fever. At this stage, there is no need for MRI, anti-epileptic medication, or antibiotics. Okay. So the nurse's responsibility is to instruct the parent to ensure that the child's safety, the proper positioning, so sideline, while they are in an altered state, and arrange for the child to see the physician as soon as possible. Okay, so that is the rationale, guys. Okay, so let's try to go back. Nurses, okay? So full bath is not appropriate at this time. Then, as a common effect, of course, guys, if fever class here in the US, they are usually giving Tylenol. So this is your Tylenol. Okay, for the fever. So sideline, yeah, that is the drain secretion. Drain secretion and to prevent aspiration. Okay. And neurology referral, follow-up head MRI, anti-epileptic, outpatient physician follow-up head system. So I guess, guys, they are talking about at this moment. So at this moment or the stage of the post-it out. Okay. So there is no need for an MRI. I don't know what's the reason for this one, guys, but I think this is one. So the nurse's responsibility is to instruct the parent to ensure that the child's safety, proper positioning while they are in altered state hands are raised.
Tylenol.
Because I think this is home. Okay? When you go back, guys, okay, this is a telehealth.
No, I'm already a
Yeah,
mommy.
it's a telehealth nursing receiving a
I want to
phone
be your manager, Prince Charming. I want to be your
call. That's why I
manager.
think I think as of the moment, no? Because I think you cannot have the MRI at home, so that's the reason why. Okay? So let's try to go
Ay,
back.
nako.
Whether each potential intervention is appropriate or not appropriate in the time of care for the time of care. Like guys, even if telehealth is they already diagnosed febrile seizure. That is the beauty of the digital world. So I guess that's the reason why, okay, the reason why there is no neurological referral, follow-up MRI, and epileptic prescription, because of course, but it's still at home. It is still at home. Okay? I hope you get it, guys. So when you look at the case study, it is still a phone call from the parent. It's still a phone call. So most probably you will be thinking, sir, why is sir MRI not included? Why is sir, how about this one? Why is the prescription of anti-epileptic not included yet? Kasi of course, there's no doctor here. But of course, when you think, sir, how about sir, the telehealth prescription right now? Okay, so perhaps guys, they will also, because remember, in seizure, we have different drugs, okay? And I think when you say anti-epileptic prescription, there are, for epilepsy, it's phenobarbital. For chronic seizure, it's phenytoin dilantin. So it's a different one. So most probably, it may vary for the drugs. Okay? Because it's
I'm just gonna
epilepsy,
sign
it's
out.
considered
I'm
as
not here for
chronic recurrent
dating. I'm
seizure.
just here for
Okay?
the
So they cannot prescribe that one yet. Okay?
study
Unless if the doctor will
Nclex.
it's really, the ongoing algebra seizure. So it's a different
I'm not here for looking
Ano,
for
what
a
I-
fam.
If stops in the because we have to be asked. So that's, I think that's the reason why. We will not prescribe it.
Lord.
Okay, so that's it. Yes, sir, the arts home and the rest of prescribe. Yes, okay. So, sir, can you go back? Thank you for that class. Okay, so, yes, that's a bit at one. Sir, the best answer of the question is I think, Ma'am Liz, you have to answer. You cannot go to the next question unless you submit. You need to submit it first back. You cannot go back. So, you have to submit it first so that another question will be generated. Yeah, will be flashed on you. So that is the difference between the computer generated and the pen and paper exam. Because in the pen and paper, you can go back to the question that you have not answered yet. So here, guys, you need to submit it first so that there will be another question to be given to you. Okay? So thank you so much. So let's go to the rationale for those who want to answer. Okay, this is the rationale. This is still at home. So that's the reason why. So there's no need for MRI yet, anti-epileptic medication, antibiotic, neurology referral, okay? Because it's still at home. Okay? So most probably the nurse will say outpatient part. The patient will go to the outpatient part. Okay, number 5. Okay, here we go. So by the way, guys, were you able to screenshot? Okay, alert. 5, 4, 3, 2, 1. Okay, I'll try to the Q&A. Okay, I think I already answered this one. So they cannot prescribe that one yet. Okay?
Follow up. Not appropriate naman.
Unless if the doctor will see
Nclex made me go crazy. No, I'm already a mommy. That's why I'm working hard. I'm not here for a dating. I'm here for the Nclex.
Okay, so that's it. Yes, sir, the arts at home and the rest are prescribed. Yes, okay. So, sir, can you go back? Thank you for that class. Okay, so, yes, that's a bit.
I don't need a man. I just need
I think,
study.
Ma'am Liz, you have to answer. You cannot go to the next question unless you submit. You need to submit it first back. You cannot go back. So you have to submit it first so that another question will be generated. Yeah, will be flashed on you. So that is the difference between the computer generated and the pen and paper exam. Kasi the pen and paper, you can go back to the question that you have not answered yet. So here, guys, you need to submit it first so that there will be another question to be given to you. Okay? Thank you so much. So let's go to the rationale. For those who want to answer, okay, this is the rationale. This is still at home. So that's the reason why. So there's no need for MRI yet, anti-epileptic medication, antibiotic, neurology referral, okay? Because it's still at home, okay? So most probably the nurse will say outpatient part, and the patient will go to the outpatient part. Okay, number 5. Okay, here we go. So by the way, guys, were you able to screenshot? Okay, alert, 5, 4, 3, 2, 1. Okay, I'll try to the Q&A. Okay, I think I already answered this one. Okay, yes, they have it, yes. Okay. Yeah, the scenario is still there in one page. Okay. Now, how about next one, guys? Number 5. The nurse imparts knowledge about the procedure and the treatment plan. Click on each twice to indicate whether it demonstrates comprehension of the provided indication or a lack thereof. Okay. So this is understanding versus no understanding. Okay, so here we go. Number 1. I need to ensure close control of my blood temperature and level of consciousness throughout her illness. Of course, understanding, right?
It's too fast. I
If my
don't.
child is awake and alert, I should consider administering acetaminophen. Okay, guys. The rectal, guys, this is if unconscious or semi-conscious or semi-responsive, right? Okay. But if the child is awake and alert, you can have the oral. Okay? You can have the oral class. Okay. Continuous administration of seizure medication will be necessary for my child. Let's try to check what is the
Good morning,
The
Coffee
age group
tayo.
most prone to febrile seizure is in age between. Okay, this is not. Okay, this is wrong. Okay, it is high probable that my child has febrile seizure and is expected to make a complete recovery. Okay, understanding. Okay, let's try to check, guys, why these two here
I need to
are
enter
no
share monitoring.
why this one?
Check.
Okay, two. Sorry. Why this one is no understanding? Okay, so here we go. The child with febrile seizure may need closer or close monitoring, while ill or potentially febrile, as one febrile seizure can be predictive of future febrile seizure. So yeah, we all know, guys, that the seizure will happen if there is fever. Okay? The seizure will happen. Rectal acetaminophen is not necessary for a child who is able to take oral medication, but may be needed for the child who is neurologically impaired or lethargic. Okay? So the rectal, guys, is recommended if unconscious, lethargic, or if the patient is not awake and alert. Okay? How about option 3 and 4? Children typically experience febrile seizure as infants or young children. Okay? 1 to 4. I'll outgrow the febrile seizure with no remaining reason for neurologic issues and will not be chronic anti-epileptic. Okay? So that is the reason why, guys. Okay? I remember this one. And this is based on experience, guys. Of course, my brother has febrile seizure before. And then when he was 7, my mother remembered the doctor saying that your child will outgrow the plan. You can stop the medication. Yes, and go. So my younger brother, which is 7, my mother was so excited, guys. She stopped the medication immediately. Good thing that she went to the doctor. And then the doctor told her, Madam, do not stop the drug immediately. And my mother would say, hey, doc, what will I do, doc? So before stopping, you have to lessen the dose. Or you have to have the medication by half. Okay? Half, then 1/4. You have to stop it gradually. Okay? So this continuous administration class, that's why it's not understanding, guys, because you can really stop. It's not for life. Okay? For febrile seizure, the medication is not for life. Okay? But if you are going to stop it, guys, you have to taper. Okay? What do you mean by taper? Gradually stop. Because if you stop immediately, it can lead to status indicators. So at least, guys, I can share you guys based on experience. Okay, so again. This continues. This is not lifetime. You can stop the drug because your patient can outgrow febrile seizure. You can outgrow the febrile seizure. Okay, so that's it. No.
Study
Let's stop
Nclex
children.
with me.
Okay, so that's why it's wrong here. And then the continuous, of course, you can stop. But when you are going to stop, guys, it should be gradual. It should be tapered. Okay, what do you mean by tapered, guys? Gradually stop. Not stop immediately. Okay, so you have to lessen the dose. Okay, until you will not give the medication anymore. Okay, so how about next? It's likely that the child will have seizure which can I have this one. Okay, so it is likely that the child will have seizure. Okay, fine. Okay. I think this is more on. So understanding, awake, okay, here, probability is unprovable, and people seizures will be probable awake. Okay, yes, this is correct, guys. They can recover, they can outgrow. Fine. And plus, I think, guys, why is it no understanding, sir? Because of the word each time. Okay? Each time. So this is an absolute word, not every time that the patient will have fever, the patient will have seizure. Okay? So I think this is one tip in your Nclex. Right? If there are absolute term every time, all, usually these are wrong choices. Okay? So I think this is the one that makes it wrong. Okay? Because it's not each time. There are times that the patient will have fever and then the patient will have a seizure. Okay, you understand that, guys? You get this, okay? So that's why it's don't understand. Yes, paper the nose, paper, very good competition, very good. Okay, yeah, very good. Okay, sir, now we start to move back after all the previous question. What do you mean by this one? So, one Claudio. Is this from your world, Cuba? Sorry for that. Okay. Rational, yes, sir. Okay, so guys, I hope that is clear. So this is the answer, guys, and this is the rational. For those who want to check on it, this is the rational. Okay. And before we go to our next question, guys, we have an alert, a passing alert.
morning. Rectal 3 and 4. 1 to 4 years old. Not grow. Na-outgrow lang nila to.
Oh my goodness, we have Dublon. Okay, Sir Dublon is always on the live before. I'm also familiar with your name, Sir Dublon. Hi, Sir Ryan. We have a fast alert from here. Good morning. Just passing by to say ding, 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 ding. I took my exam on April 29 and got my result yesterday that I passed with I-pass. I will miss your lecture, Sir Ryan. Thank you to Sir Ryan. Thanks to all the members and the rest of the team. Thank you so much, Sir Ryan. I got 150 items. Ayaw yata mag-stop na computer. The computer doesn't want to stop. I have lots of case studies because in around 10, 3 bow ties, prioritization, SATA, and standalone. To my fellow students, they can study schizophrenia, DI, silent. Oh my God, I have pre-trending topics here. Preterm labor, uterine anatomy. This is really that. This is really that. Okay, I think I need to screenshot this one. Okay, thank you. Digoxin toxicity, pulmonary embolism. And the last question is SATA. Okay, that is Kegel's exercise. Okay, thank you again and good luck to all the students. Okay. Okay. Nanood na sa Sir Rai. Yes, Sir Calvin. You must have Sir Rai. I'm not so sure about that, Sir Juan Claudia. I think they are going to restart if you answered all the feedbacks. Okay. Good evening, Sir Rai. Latecomer today. Apologies. Okay. Ma'am Armin Gold, no problem. I'm a girl, Sir. Girl, para si Dublon. Okay. Ma'am Dublon, sorry for that. Okay. Pa-share ng tips, Sir Rai. Okay. Say, from time to time, I will give tips also, guys. From time to time. Okay, next one. Ma'am Dublon, congratulations. You are now a USRN. Thank you so much for motivating your classmates. Okay, now let's go to number 6. A client has a left pulmonary ischemic anomia after suffering from cerebrovascular accident. What is this one, class? What is it? Pulmonary ischemic anomia is loss of half. Okay, of the visual field. Okay, loss of half of the visual field. So the question is based on this fact, which of the following action will first include in the plan of care? What's your answer? Support the left arm and head. Okay, so this is left pulmonary ischemic. Apply the punch to the client's left eye. Encourage the client to use his right hand for his activities of daily living. Place the client's field on the right side of the overbent table. What would be the answer? Okay, let's try to choose the answer. Pulmonary ischemic eruption involves the loss of half of the visual field. A client with left pulmonary ischemic eruption should be approached by the nurse on the right side and to place the personal belongings on the right side. Okay, your number 3 is done for unilateral neglect. Option 3 is done for unilateral neglect. Okay, so please, okay, your answer is number 4. Because there is left pulmonary ischemic eruption. Okay, all right. Okay, so again. Why is this answer, sir? Okay, involves loss of half of the visual field. Okay, should be approached on the right side. Okay, because if you approach on the affected side, the patient might risk here. Okay, and of course, the belongings, the personal things, okay, deodorant, toothbrush, it should be on the unaffected side. Okay, it should be on the unaffected side. I don't know, guys, if I have a picture on this. I'll try to look at this picture for this one. I'll try to look for a picture of the pulmonary ischemic eruption so that we can understand. Okay, okay, during break time, I'll try to look for a picture of that one. Okay, so that's it. You have your number 4. Okay, it's the best answer. Okay, it's the best answer, guys. Now, how about next, guys? Let's proceed. Okay, let's go to the next one. Okay, 7. By the way, the eye patch is, I think, very common in diplopia. That's the management for diplopia for the eye patch. Okay, now how about next, guys? Okay, so please screenshot your number 4. That is the answer. Number 4. Okay, here we go. Number 7. A client is given instruction. The client has Parkinson's disease regarding maintaining mobility. Which of the following statement when a client determines that he understood the instruction? Like Parkinson's, there is problem in mobility. Okay, so if you know Parkinson's, guys, there is tremors, rigidity, and bradykinesia. There is slow movement and akinesia. Those are the signs of symptoms. So what should you do? I will sit in a soft and deep chair. No. Okay? As much as possible, the chair is elevated. Okay? Or we have your raised chair. Okay? Or elevated chair. Or high chair. Okay? As much as possible. So that the patient will not have a hard time in getting up. Okay? I must exercise early in the morning. It's okay. Okay? Exercising, guys. Okay? But just the usual exercise. Walking, stretching, something like that. I should rock back and forth in the shape movement. This is correct. This is from Saunders. Because the patient in Parkinson's class is having difficulty of starting the movement. So what are you going to teach the patient is to, okay, Lola, okay, rock back and forth. Okay, 1, 2, 3, so that the patient can walk. Rock back and forth. Okay, how about next? I will buy clothes with many buttons? No. Okay, no buttons because remember class, the patient is trembling, there is tremors. So that will be, the patient will have a hard time to undress. Okay, so what should be the recommended? So the recommended is Velcro, guys, like this. This is the recommended, so that the patient will be encouraged to do the dependent, or the patient will be encouraged to do the ADLs by himself. Okay, so Velcro, do not use many buttons, guys. Okay, how about I will plan activities throughout the day to inhibit daytime sleeping. Okay, to stop daytime. Okay, plan. Yes. Okay, number 5 is plan the activities. That's very, very important. Okay, so here we go. The client should plan all activities for the day to prevent boredom and daytime sleeping. The client with Parkinson's disease must exercise in the morning when the energy levels are high. The patient may rock back and forth in order to facilitate movement.
Do you speak
Because they have
English?
activation,
Yes,
there is
hello.
access to movement. Or
Are you
bradykinesia
studying
and
Nclex
slow
too?
movement. Okay, and then when you say Parkinson's plan,
Nclex makes me go crazy. It's really tricky. Hi. Are you still studying Nclex? Study hard. Oh, my wife is 25 and I am 30. Hi. So, your wife, who is taking Nclex? You or your wife? Oh, you're too young. Guess my age.
The patient plus is having a slow posture, then shuffling gait, small steps. Okay. And again, guys, buy clothes, avoid because it will be difficult to get. Instead, you should buy clothes with Velcro fastener or slide locking box. At least guys, if you are going to buy
Look at
clothes
my
with Velcro, it will be
papers.
easier. Like for example, if Lolo and Lola wants to have loving, so if Lola will say, Lo, come on down, Lo. See, Lola is if having Parkinson's guys, and then there is many Lolas, guys,
Nclex.
it will be a hard time. The Lola will lose the momentum.
Mababaliw na ako.
While if Velcro, Lo, come on down, Lo. Then Lolo, okay, for the international student, Lolo is grandfather, Lola is grandmother. Then the grandfather, the Lola's Parkinson, ready to rumble. It will be easier. Okay, ready to rumble, Lola. Okay. So how come I answer wrong answer with the segregation attitudes mainly did? Okay, yes. Or sir, enjoy quickly talaga sir. Velcro. Okay, rocking chair sir. Yeah. Okay, so nurses, I hope that you find value of this. So that's the purpose of the Velcro fastener. It can also be seen in the umbrella light, right? Okay, the Velcro fastener. So avoid with many buttons. That's let's proceed next. Number 8, okay. Number 8. Which food-related behaviors or manifestation are expected on a client who has a stroke that has left him with homonymous gaming adoption? What will be the answer, guys? Homonymous gaming adoption. Eh? If everyone is laughing. So, same as my grandmother, which suffered from issues of her right side, so put everything on the left. Okay, that's good. Okay, that's good. Okay. So, what will be the answer, guys? Okay, number 2. Homonymous gaming adoption is blindness or loss in half of the visual field. This is the reason why the Bible says only half of his plate.
Mali na naman.
Guys, wait, guys. I need to show you because some of you are visual learners. Just give me time. I need to base this one.
Ito yung food
I need to
only.
base this picture
Half
so that
of the plate.
you can understand what is loss of half of the visual field. Okay, for a while. I think it's in my other.
Oh my God.
Wala.
Ah, no, no,
other,
Ha? Anong
Other-
format? Sorry. No. Oh my God.
other slides.
I think
I just want to show it to you guys so that
so
you can
sorry.
visualize what is this homonymous gaming adoption, sir. Here. Okay. For a while, just give me time, guys. Give me time so that you can understand what is this homonymous gaming adoption. Yeah, we'll just paste it here.
I think you got the wrong platform. Sorry.
Okay, so it's here.
Diyos ko, Lord.
So this is what I'm telling you. This is harmonic.
I'm not here for that.
Here, this is the vision of the patient. Okay, this is the vision of the patient, guys. So same like
Oh my
it's
God.
like you are going to close one of your eye, and then you have to cover the so it's only half of the visual field. Okay, it's only half of the visual field.
$2,000.
Okay, so that's the vision of the patient. And if you are eating plus this is also your vision, guys. Something like that. Okay, so what will happen is you cannot see the other half of the plate. Do you get what I mean? So that's why, guys, this is the sign and symptom. This is the application of Nclex. Okay, eating food only on half of the plate. Of course, forgetting the
I'm
name
not
of the
interested.
It's more on your memory. Okay, improve reference for food hygiene. It's
We are
not
looking.
as well. This is not. So it's this one. So if you want to screenshot, guys, okay, this is the other. Okay, so again, forgetting the name
I'm
of the
working my ass off.
This is not
I
related to
don't
having
need
one most gaming option. And the dysphagia is common in applying to stroke, but involves application of the
I can
water.
earn that someday.
So it's half of the. Okay, so guys, that's why, guys, it's not as possible,
Sorry,
guys.
you got the wrong
Okay?
place.
Patient having homonymous dementia will be having a
You
hard
can
time
leave.
to
You
read,
can leave my
because they are reading
You
plus
can
only
leave
half.
the chat.
Right? Only half. So, are you those patients with homonymous? How will they read, sir? Okay, they will be doing that only, guys. Or some of my students are telling me, sir, they will just put the book here and then they will just do this one on the book. Then somebody asked me, sir, how about if a student from Nclex, sir? Well, you do that one, guys. It's necessary. Okay. Not to demean those patients with stroke, but again, this is only for lecture purposes. Okay. So how about next slide? So this is the real one. Okay. Again, this is just for lecture purposes, guys. Okay, so that you can understand and grasp what is homonymous gaming adoption. So that is your vision. So it's very hard. It's very hard, no? Okay, if you have this one and then you're reading a book. And this is the food. This is what I'm telling you. Okay, next one. Number 9. A 68-year-old client, okay, arrives at emergency department with complaints of numbness and tingling on the left side of the face and the left arm began 2 hours earlier. Upon assessment, the emergency department nurse notes a focal neurological deficit on the left side. A stat CT scan of the brain is ordered and confirmed. Okay, here we go. So I think I need to highlight this one. Ischemic stroke. So we have 2 classes of stroke. We have your hemorrhagic, which is because of the rupture, because of the high blood pressure, it rupture, guys. So there's hemorrhage, it's hemorrhagic stroke. Ischemic stroke is related to the obstruction. Right? Somebody's answer 6 and 7. Okay. Okay, 6, 7. But let's, okay. Okay. Somebody answer 5. So it's already more than 4. So that will be the answer, guys. Okay, final answer. Okay, here we go. Respiratory status, of course, you're correct. Okay, airway is the first one. Neurologic status. Okay, medical history and child location and position. Okay, so that's the answer, guys. Okay, so the nurse needs to identify if the, what will be the answer here. So that once you submit, that you cannot go back. Okay, number 5, the patient will have seizure. Okay, so it's here, it's here, it's here. Upon assessment, the emergency department nurse notes a focal neurological deficit on left side. A stat CT scan of the brain is ordered and confirmed. Okay, here we go. So I think I need to highlight this one. Ischemic stroke. So we have 2 classes of stroke. We have your hemorrhagic, which is because of the rupture, because of the high blood pressure, it rupture, guys. So there's hemorrhage, so it's hemorrhagic stroke. Ischemic stroke is related to
Bye
the
bye, Peter the
obstruction
weirdo.
due to thrombus or clot.
Oh my
Okay,
god.
now,
You know
so
what?
when you
It's
see
really
ischemic
hard
stroke, guys, the
to.
cause of this one
I know.
is your clot or the thrombus. Or the
You're not my
now, the vital
audience.
signs are follow. BP is
You can
180,
sign
so
out.
there's a high BP here. Heart rate is okay,
See,
normal.
I'm
Heart rate,
working
normal.
my-
Temperature is okay, normal.
I'm
And
working.
ultrasound is normal. The flight has no known medical history and does not take any routine medication. So let's proceed.
I can
Which
earn
of the following
money.
actions should the emergency
I'm not
department
just
nurse-
type of that
Okay, so the situation, plan for
girl.
the flight. Select order of flight. Okay. Sana. Sana. Okay, so let's try to check.
You know what? If you're a parent,
So the answer is 1, 3, 4,
Seriously.
5, and 8.
seriously, if you're already a parent, or you just have a sister, you know, it's the internet nowadays are so scary. It's really scary. Reading that comment, you know, it's as a parent, as a mom of 2, I have a daughter. I'm scared for her future, so I really want to study hard, be smart. So I will share my daughter the knowledge that, oh my god, she's really have to study hard for her future, because nowadays there are some just like that person, you know what I mean. So if you're here for some of the type of um, activity, you're not welcome in my chat, or there's a lot of website you can go there, but literally I'm working my ass off just to pass the Nclex and give my family a better future. And you guys are commenting on my chat, or on my page, like threesome. Sorry, you're not the right audience for me, because this mom is working hard just to provide for my family, to give them a better future. I don't know. Sorry. Anyways, so um, I'm doing my live, studying for Nclex, hoping I can make it. I'm working my ass off just to pass the Nclex. So if you're not the right audience, you can sign out, and I'm just gonna ignore you. But if you're the right one, you can stay.
Okay, so 1, 3, 4, 5, and 8. Okay, so last try. Okay, why are these the answers, sir? Ischemic stroke
Oh my
occurs
God.
when a cerebral or carotid artery is blocked. Okay, several interventions are necessary to ensure the safety of a stroke patient. Question ischemic stroke of
1, 2, 4, 5, 6, 7, 8. 1, 3, 4.
can have impaired swallowing, which can lead to complications such as aspiration pneumonia. So number 1, the nurse must perform a swallow screen following facility protocol. Okay, so you have your swallow screen test. Okay. Following the facility protocol to assess any swallow difficulty, and should keep the client NTO until further diagnostic tests such as video fluoroscopic swallow study conducted by a speech language pathologist are completed. Therefore, fecal liquid should not be given until the appropriate testing is done. Okay? But actually guys, if that is already done, guys, we can have the fecal liquids. Okay? So, again, the word
Oo
only.
nga.
Inward only. So again, another thing, it can be that after, okay, after the swallow split test.
People.
Okay, administer fibrinolytic. Okay, let's move on. So again, therefore, the pill should not be given until the appropriate testing is done. So this is option 2. Okay, I think, and also guys, another thing in your exam, only is also an absolute word. So that's why sometimes class, that makes it wrong sometimes. Okay, but only use those tips guys if you don't have any idea, because those are one of the testing strategy. Okay, now anyway, here we go. Number 3, the nurse should anticipate an order of
Okay.
fibrinolytic. Fibrinolytic plus this is your thrombolytic. Okay, thrombolytic. So it meets the criteria that we can have this one. Of course, it is as ordered. No? Okay, so, anyway, this is an emergency nurse. Okay, now how about next guys? Okay, so this is in the ER. Exclusion criteria include more than 4.5 hours since the symptoms onset, age over 80, use of anticoagulant, ischemic damage to more than one-third of the brain, severe neurological impairment, and a history of both stroke and diabetes. Okay, so again, okay, we can have for ischemic stroke, we can have because when we say fibrinolytic crisis, I think same with thrombolytic, it is all class. Okay, so since the client does not fall under the exclusion criteria, they are candidate for fibrinolytic therapy. Okay, so let's go back to the question. Emergency, 2 hours earlier. Okay. An assessment that he knows focal neurological deficit on the left side, as CT scan. Okay, okay. So these are the exclusion for the fibrinolytic therapy class. So you have to ask guys if the patient is, what is the age of the patient here? 68. I said it's okay. It's okay to give. So you cannot give the fibrinolytic if over 80, use of anticoagulant. Ischemic damage to more than one-third of the brain, severe neurological impairment. So I think there is a focal impairment only, and a history of both stroke and diabetes. Okay. So since there's no exclusion criteria, you can give fibrinolytic. Okay. Next one. Option 4, an electronic infusion pump will be required for the safe administration of this therapy, and the dosage should be double-checked by another licensed nurse. So it's okay to have infusion pump lines. Okay, you can screenshot this one. Is 5, 4, 3, 2, 1. And then option
Nclex.
a cardiovascular assessment is also essential to check for heart murmur, arrhythmias, like atrial fibrillation, and hypertension. So try to check if this are correct. Okay, yes, okay, correct. 5 is correct. Okay, how about number 6? In addition to invasive procedure like inserting an indwelling urinary catheter, should be avoided for at least 24 hours following fibrinolytic therapy to prevent bleeding. So that's why spoke about this number 6 guys. Okay, so again, your invasive procedures like inserting a catheter is avoided for at least 24 hours following fibrinolytic. Okay, and then number 7, option number 7 for ischemic stroke, a blood pressure of approximately 150 over 100 is necessary to maintain a cerebral perfusion. Okay, since this client's blood pressure is 152, IV antihypertensive, okay, medication is not required. There's a term for that one class from surgery. I forgot what's the term for that one. The hypertensive in order to promote the blood. Okay, permissive. Thank you for that one. Permissive hypertension. Yeah, that's the term I think. Okay, so again guys, they will not give the medication, the antihypertensive medication first. Okay. So, since we need that blood pressure to maintain that cerebral perfusion, so that is, yes, very good. Thank you so much for that. So, this is, I think, the permissive, okay, hypertension.
I think I'm gonna sign on. What is that?